My turn. Oh, okay. Hi, humans. Welcome. Good to see you. I think a few more people will trickle in, but the cool people are here. Thank you, Eric. And the first thing I want to say is that I am not an expert on ghosts and spirits. I'm just a translator who has interest in certain things. So, um, just a couple things. Got the chat up. Need my little pen. Okay, and one more thing, and I'm ready to go. So yeah, I thought maybe for Halloween and Dia de los Muertos, today's the second day of that this might be an interesting topic. Even at other times of the year too. Anyway, just an introductory slide. Ghosts and spirits have always been a part of the history of Chinese culture, even up until today. Also, Western culture and probably all cultures. But that doesn't mean that people always believed in them. Sometimes, especially maybe in the later dynasties, you know, people, doctors or educated people might be somewhat skeptical of ghosts, but if the patient believed in ghosts, then sometimes the doctor needed to treat it like it was ghosts. And so we're going to see as we go through, you can make up your mind what you think was in the doctor's minds who wrote these things or the case studies. But it doesn't, just because we're talking about ghosts doesn't mean that we have to believe in them or not believe in them. And so there were lots of ways that ghost possession or, the appearance of ghost possession was treated. Herbs, including, I'm sure that most of you know that we use some minerals and shells to weigh down an agitated spirit and things like that. And certain minerals were considered to have certain properties for Hun and Po and so forth. I'm not necessarily going to talk about that today, but acupuncture, I think you've mostly heard of Sun Tzu Miao's 13 ghost points. And so, we use our herbs, our acupuncture, our moxa to treat this kind of a thing, but also the ancient doctors talked about incantations and talismans and rituals. And so we're going to get a glimpse into this kind of stuff. We'll see many of the doctors were skeptical, that they may still believe that some cases are ghost possession and other cases are not, but they didn't just seem to automatically see ghosts everywhere around them. They often had other explanations. So this is what we're going to explore today. I don't know why I'm starting with cases. I like cases. Actually, the first couple of cases don't involve ghosts. They involve maybe deities or, some kind of spirit being. So anyway, I really like this first case. It's from a Ming Dynasty doctor named Sun Yi Kui, and he wrote, a book of case studies. He wrote some other books. He was kind of an important Ming Dynasty doctor, but not one of the most famous ones. You can see his dates, late Ming. So also I like this case because it involves a female doctor, and he hates the female doctor, but we're going to see if he's maybe prejudiced. Okay, so here's this case. The ancient doctors, they always bragged about how important their patients were. So the wife of an important guy was the granddaughter of an important guy. Whatever, We don't care. She was 25 years old, and her body was constitutionally weak, and her speech was proper and circumspect. This is actually important. Note that she, spoke very properly for a 25-year-old woman at the time. We're going to see some changes happen. She became grief stricken. She had a sad situation. First, she had a difficult childbirth. And when the child was born, it was a girl, which was a disappointment to her. That's a whole nother thing. But then the girl died. And so, grief after grief, physical pain, grief, all kinds of problems. So at the time the baby died, she lost consciousness. And when she awoke, her mental state was nightmarish and confused, and she was convulsing, and her eyes were staring straight ahead. She wasn't, very responsive. So Sunikwe arrives after the convulsions are happening. And so he can't take her pulse because I guess her arms are not cooperating. But he asked the family about her. And from the time that the child was born, there was no discharge of lochia. So in case you don't know, lochia is this discharge that happens after someone gives birth. And it's kind of like a menstrual period, but there's more mucus in it. It's not exactly the same, but there's this discharge. And in Chinese, it's called elu, which is kind of sounds like an ugly name to me. Like this is like something really bad, disgusting, or something like that. And dew drops in the morning on the grass. So that's, what it was called. We can see they had a bad attitude towards it, and they thought that you really needed to get it out of your body. So they were really concerned to make sure that there was enough discharge after the woman gave birth, but she didn't have any discharge. So the family surprisingly had a female doctor. And I do want to point out that they used the word E, which means a doctor, not a midwife, not, some granny or something like that, but like they used the word doctor. And often the male doctors were not very happy with female healers, midwives and so forth, and said bad things about them. So it's surprising that he calls her a doctor, but he does. And so she must have a certain level of training, but he still hates her. He hates her. We'll see. So, the family, they had a female doctor who they trusted. And so this is Sunikwe talking. This is not an objective source. Okay. So Sunikwe says that the female doctor had randomly, indiscriminately given this woman a ginseng, like just to chew on a piece of ginseng, as well as dushentang, which means only ginseng. It's like more ginseng together with rice porridge. And so the doctor felt that the ginseng and the rice porridge clogged her in the region above the diaphragm, so that everything was all gummed up, and she's having, issues with the heart orifices and so forth, because everything's all gummed up and congested and stuck. And so all of that stuff was stuck in the upper jiao, and then her Shen spirit was clouded, and the convulsions just kept going. So I, Sun Yi-Kwei, asked them to make her vomit. Just like I'm sure some of you have stuck your finger down your throat to make yourself vomit if you need to, right? So he wasn't going to do that. He's a, doctor, but somebody stuck their finger down her throat, and he was pleased that she vomited up a bunch of phlegm and fluids and porridge and the herbs that she had been taking, and the convulsions stabilized. And then he gave her another formula. You can read, the herbs on your own. Actually, I was looking at something today, and some of these are a particular formula for postpartum issues such as this. And so she swallowed it and she was able to have a natural sleep, not an unconsciousness. And so he's hired by the family. He's going to stay until she's better. So he goes out to wherever he's going to sleep. And I could not have predicted that the female doctor would again secretly give her more of these herbs. He's really mad at her. Anything she does, he's going to say is wrong. And we don't even know that she did that, but he's blaming her when his treatment isn't working. So maybe she did, maybe she didn't, I don't know. But after 11 p.m., the patient was suddenly manic and frenzied. And she was speaking as if the gods had descended into her. You know, in China, as in other places, they have mediums that channel spirits of the dead, but also may channel minor deities or gods or whatever. So she's channeling something, and she spoke what he calls confused words. Okay. And she's saying, I am Guan Yin, I have descended to the altar. So she's speaking as if she's Guan Yin, who's an important Chinese deity. And then she was speaking all in scholarly and refined official speech, which means Mandarin. And, you know, I think there's some place in the South. I don't know. I don't remember where they are, but they're not native Mandarin speakers. So she's speaking in a way that's not her normal manner. She's asking, you know, people are asking questions and she's answering fluently. Her voice was quite strong and formidable. Remember, she's like this delicate, weak 25-year-old female, and she was speaking properly before, but now she's speaking powerfully, which of course Sun Yikui doesn't like. She definitely lacked the appearance of postpartum insufficiency. In her whole life, she had never heard Mandarin, but now she spoke it as if she was born with it. Everyone was so surprised. They regarded her as if a deity had possessed her, and they were praying to her. You know, all the family, all the servants, you know, everybody that's around is like coming into the room and thinking, wow, Guan Yin is speaking to us through her. So I, Sun Yikui, the arrogant doctor, I alone admonished her, talking about this and that. I said, this is incomplete discharge of logia. And so the stored up blood is making these symptoms. It's like you're seeing ghosts. And he told everybody in the room, she's not really possessed by a god or a Buddha. You know, this isn't real, this isn't happening. You know, she's crazy, she's not channeling Guan Yin, he's saying. Then I gently used proper words to rebuke her, and she fell silent. So then he gives her a formula called Qing Hun San, which is Hun clearing powder. And I looked it up. There are a couple of formulas with this name, but the formula that comes up the most actually has ginseng in it. And remember, he just yelled at the female doctor for giving ginseng, but the formula has ginseng in it and some of the other herbs that we saw listed before that he had been giving her. He added a couple other herbs and gave her this formula. And when dawn came, she started urinating. I didn't know that had been a problem, but that seems to be, you know, not the lochia, but urination seems to be. And her mania had stabilized. So I went out of the room for a short time, and who could have expected the female doctor intended to take credit for all my achievements? I still have no idea what herb she gave the patient. A moment later, then the mania came back as bad as before. So now I gave her some other herbs, which again are some of the same herbs, some different herbs, but some of them are the same that he had been giving her. And she took a couple packages in a row, but it was not effective. You see, Sun Yikui, you're not always right either. So I went against my earlier earlier thoughts, I thought, gee, there must be phlegm in the chest, and there was no ingredients to transform phlegm in the previous formula, so it didn't work. And therefore he, gave her the same formula, but now he added shanja. The lochia started moving, her mental state became better, and subsequently she slept a little. But in a short time, her hands and feet started, having minor convulsions, and she started slapping her own face and beating her own chest. Poor woman, poor woman. And so she was in a muddled frenzy. And I examined her pulse, which was getting more and more deficient. Remember, she had had a strong voice before, and those convulsions, some of them sound pretty, strong. So her pulse is getting weaker now. In the morning, her face had been red and bright, but now at 3 to 7 p.m., her face was white, meaning very pale. This was blood moving and fire retreating. So when it was red, I guess there was fire flaring up, and she was agitated and manic, but now the fire is calming down. The pulse was deficient again. So now she needed supplementation. So of course, now he's giving her ginseng, even though he complained about the woman doctor giving her ginseng, right? Some of the same herbs that are in this what was that called? Qinghuan San or whatever, the earlier formula that was mentioned. Added some other herbs, including shanja, because he thought that would be good for her phlegm. Fuling and Chenpi can also help with that. And then Hupo, which is amber, I think. And that's one of the ones that, if I remember correctly, that's good for the Hun. So in any case, then an hour later, she loudly belched twice. I happily said, "Oh, you're belching? It's clear yang moving up, and turbid yin is now moving down. And so she's going to be okay now." And then that night, the lochia started flowing. She had a bowel movement, and now she's asking for rice porridge. So like she's better. She actually wants to eat. And then they asked her, "How did you learn to speak Mandarin yesterday?" And she said, "I don't know." So that's the story. It goes on after that, and he continues to complain about the woman doctor, and he compares himself to some military general that was stopped by a eunuch from doing what he should have done, and the eunuchs are always vilified, and he's comparing her to a eunuch. So he's just going on and on about how horrible she is. But anyway, this is a case that you could interpret as a type of possession or not, depending on how you looked at it. And did he just not want to credit her for being able to channel Guanyin, or was Guanyin actually speaking through her? How did she learn to speak Mandarin suddenly? Or was it just her craziness? I don't have an answer, but this is an interesting case. So any questions or comments about this case? We're going to see that most of the ghost issues are going to involve women. Not all. There are ghosts that bother men. Actually, more often men get bothered by fox spirits and stuff like that, but ghosts often bother women in ancient times. Okay, so the following is from a book by somebody named Yu Tuan, who is a famous late Ming Dynasty doctor again, and it's discussing an earlier case. And so there's this thing in Chinese medicine, Chinese culture, called ghost fetus. And that's probably what we would call a false pregnancy today, but they had a different perspective on it. So this guy, Dr. Yu, he's talking, he says, "Perhaps you might ask, how do ghost fetuses happen? How does that happen to a woman?" I say, whatever you think about in the daytime is what you're going to see at night. like what's on your mind in the day, you dream about it and so forth. So whenever the nature of someone, regardless of gender, is lustful, but at the same time they're deficient, then minister fire is going to flare up from the kidneys through the liver. And so a person who's like really exhausted often dreams of intercourse with ghosts. That's like a whole category of disease, intercourse with ghosts. It's kind of an interesting thing. I'm still trying to figure out, what do they mean? Is it just any sex dream, or is there something special about intercourse with ghosts? That I think that's a traditional character. Sorry, there's a question in chat. Um, so so in any case, then this ghost fetus, according to Yutuan, is really a fake fetus. There's no actual intercourse with ghosts. That doesn't happen. There's no intercourse with deities. So it's a fake fetus. It's not an actual fetus that has a supernatural conception, to it. He says, an ancient prescription book, he doesn't say which one, says endless longing and unfulfilled wishes. So if you were at the session of these that I've been doing, where we talked about emotions, we talked a lot about like longing, and it's actually the same word that means, that we usually translate as thought when we're talking about the emotions. That word, like the earth, the spleen emotion, thought, is also translated as longing in certain contexts. Okay, so endless longing and unfulfilled wishes become some kind of like, ooh, like turbid stuff that flow into the uterus. It binds up and it congeals into a quote ghost fetus. So the root is the woman's own blood, her own fluids, her own like turbid, dirty fluids, and her own jing that gathers and congeals into a lump. Then she has symptoms just as if she's pregnant. So how is this not a fake fetus? It's from her own fluids. It's not a conception with a ghost, he's saying. So somebody remembers an old case, and so there's this question somebody asks him. I've read from a case by Huabo Ren, or who's also known as Hua Shou. He's the late Yuan dynasty doctor, famous doctor. And so Hua Shou, or Huabo Ren, said that there was a female attendant at some temple. Her family name was Yang, and so she's a temple attendant. And so it seems from what comes later that she's like a temple virgin, right? That her job requires virginity. She's married to the deity. She's not married to a human. Excuse me. So this temple attendant Yang has been wandering on the temple's veranda at twilight and saw a deity that was dressed in yellow clothing. And she felt something in her heart. Oh, he's so handsome, that deity. And that night she dreamed she had intercourse with him. And then her abdomen got enlarged as if she was pregnant. And so the question is, they continue with the story. They invited Hua Shou to treat her, and he examined her and said, oh, this is a ghost fetus. And he gave her herbs to break blood, basically, herbs that would induce an abortion. And make the fetus fall, which is another way of saying abortion. What came out was a whole bunch of stuff that looked like tadpoles and fish eyes. And then she was all fine again. Isn't this intercourse with a deity? So I say, so that was the question. Like, here's this case from Hua Shou, which, yeah, I've found that case independently, but now Dr. Yu has been asked about this case. And Dr. Yu says, this event actually occurred, but the intercourse with the deity was not the real reason. So he's saying, sure, there was a temple attendant, and yeah, it seemed like she was pregnant, and yeah, Huasho gave her herbs, and yeah, she had a discharge of some tissue. That part is true, but it wasn't because of intercourse with a deity. How could something formed of earth and wood, a statue, a deity, a statue in a temple, how could something formed of earth and wood have intercourse with a person? And how could it even have any semen to conceive a fetus? He says, it wasn't a fetus. I'm sorry, it wasn't a deity deluding the girl. It was a girl's delusion of a deity. Right. So she's fantasizing about it, and her fantasy made it happen. And take a measure of this girl. She's growing older without a husband. They really thought you needed a husband. I'm sorry to tell you, it's not true. Anyway, so yeah, she's growing older without a husband. This is called endless longing and unfulfilled wishes, which is what he said before causes, these so-called ghost fetuses. Learned and virtuous scholars, I'm talking to you, do not believe these delusions, he says. So, okay, so any questions or comments about that story?
It's interesting to think about the transformation of her own bodily fluids into a sort of fetus-like thing, especially when we think about like breast milk coming from blood in Chinese medicine. Just thought that was interesting.
Yeah, it's his point of view. So you can decide she actually had ghost intercourse with a deity in the temple, or you could decide his more, physical as opposed to metaphysical explanation. Huasho thought it was ghost intercourse, but Yutuan thought it wasn't. So I think, what I find interesting is that different doctors had different takes on it. But there was definitely a more, quote, scientific group of doctors who thought that there's a physical explanation for this, or at least a natural explanation, not supernatural. Anyone else?
I'm not ruling out actual possession for any of these. But I think it's interesting that he's saying like, no, the deity, like the statue, couldn't possibly have gotten her pregnant. But I mean, I thought that the statues were just like representations of something, that's not in physical form necessarily.
What would be interesting to find out is like what his religious spiritual beliefs were. Like, was he Buddhist? Was he Taoist? Was he like Confucian? Because Confucius said, respect ghosts and spirits, but keep a distance from them. Don't mess with them, is what Confucius said. So if he's Confucian, he's going to be a lot more skeptical, and a lot more about humans. But if Buddhist or Taoist, he might be more inclined to believe. So that's actually an interesting direction to do some research about some of these doctors and why they came to the conclusions that they came to. And I agree that I'm not necessarily ruling out the possibility that there was some kind of, supernatural event, but I'm also not saying I believe it's like, how can I know? How can I know? But anyone else or anything more? I hope these are interesting.
Yeah, they're very interesting. I was just gonna say like the whatever she did end up, passing, like also that could have been something like because she could have had something else going on, not you know, like is it possible to pass an ovarian cyst or something like that?
Yeah, or some kind of blood stasis or mucusy thing. And in fact, we don't even know if she actually was, maybe she was having sex with someone and thought it was a better story to say it was a deity. Right? Um,
Or she would have gotten in trouble if she said that it was another person. So it's much
right.
better just to say it was like a spirit or a deity.
Exactly. And they're not describing any odd behavior on her part, besides the fact that she said she was hot for a deity. Right? They're not describing her as raving like they were in the first case. So yeah, I don't think we can necessarily know, but it's interesting to look at all the possibilities, the possibilities of what could have actually happened and the possibilities of what different people could believe.
But the description of like tadpoles and the fish eyes is very specific.
Yeah, there's some pretty weird descriptions that you get of like some of this kind of stuff. There are other stories. Yeah.
Like,
Creepy stuff. Anyone else?
just like back to the first case, like everything about that, like could be explained. You seemingly could explain it by like just like some regular medical condition going on, except for the fact that she like out of the blue starts speaking Mandarin and she doesn't know that. It's like, how else would you explain that? And like, why would they include that if it wasn't actually happening, you know?
Yeah, that's really an interesting part that Sunny Kue doesn't explain. He just wants to rant about the female doctor. Anything else? Okay. So here's one of a child. Some of you may have heard this before. I used this in the history class. So Qian Yi is the first doctor that's like attributed as being the first pediatrician. Other doctors, of course, treated children, but he specialized in children, whereas other doctors would just treat children among everyone else. So anyway, so the son of some government official was 5 years old. He became ill with his eyes staring straight ahead and he wasn't eating. Someone said he was made to do this by an evil spirit and requested a shaman to invoke the gods and burn paper, either paper offerings or talismans. We're going to talk about talismans a little bit later. But the kid didn't recover. And so the shaman didn't, heal the child. So then they called Qian Yi and he arrived and said, "This is a disease of the organs. What use is praying to the gods?" And then gave him a formula and the child recovered. And so this is, 1,000 years ago or 900 years ago. So you can see that they're skeptics 900 years ago. Of course, we don't know. Maybe Qian Yi would think another case was actual possession. We don't know, but at least this case, he's saying, come on, it's an organ issue. By the way, I made a video, it's on my YouTube channel about ghosts. It's not a medical video. It's just like there are all these stories of the strange. And so if you want, to hear more ghost stories from ancient China, there's, it's like 37 minutes or something like that on my YouTube channel. This is the medical one. So those are 3 cases. I want to move on then from the cases and start talking about then how did doctors deal with this? Volume 9 of Zhenzhou Dacheng is a volume that I have translated and is published. And one of the reasons I wanted to translate this volume was that it did talk about possession type stuff. That there are other things in this volume I was really interested in, but in any case, so Yang Jizhou is the author, and This section is called Secret Essentials on Needling Evils. So sometimes the word evil means something more serious than just weather chi. And here it is meaning something more serious. This here says that Yang Ji-zhou is the author. And why does it say that? Yeah, he's the author of the whole book, but actually large portions of the book he copies from earlier texts. But this is telling us this isn't coming from an earlier text. This is Yang Ji-zhou himself giving you his point of view, not quoting earlier people. Actually, some of it is a quote. There's like in Chen Jin Fang by Sun Tzu Miao, there's a paragraph that's pretty similar to this. And so he's talking about, I mean, it's funny, there's, no real heading except needling evils, but here he doesn't mean weather chi evils. And so he says the patient generally could be male or female. Some of them sing, some laugh, some cry, some are chanting stuff, some speak a lot, some are silent all the time, some are angry constantly, some move around frenetically all day long, like manic kind of stuff. Some have evil in their mouth and eyes. I assume evil in their mouth means their speech is really, scary, and evil in their eyes, they're glaring at you. Some have disheveled hair and bare feet. Some take off their clothes and reveal their body. Some say they see ghosts and spirits. This type of disorder is a flying bug. This is like a really weird sentence. Where did it go? Sorry, I'm having a hard time there. This word chong means creepy crawly things. It could be lizards or snakes or bugs or spiders or just any creepy crawly thing. It could be supernatural stuff. So it's a flying bug, supernatural spirit. He does use words that say it's supernatural. It's an evil demon or a wild ghost. The 100 evils invade to harm the patient. So it really seems to me that he does think it's supernatural. He's not saying it appears to be, he seems to be saying he believes that it's supernatural. And so when you're going to treat such a patient, here's what you need to know. First, he has headings for all of these things: contentedness, or however you want to translate that. This means, he says, that the patient must have respect and confidence in the doctor, and the physician must have a sincere heart in order to treat. Only when both, feel this kind of, they're happy enough with each other, can the ghost evil be eliminated. If the patient hates the doctor, doesn't trust the doctor, it's not going to work. So there must be some kind of bond between the patient and the doctor, he's saying. And then this last sentence here is kind of quoting from an old history book, from the story of Bien Chui's life, another famous doctor. He says, if the person in question hates the Bien stone, which was used before acupuncture, to like lance a wound or to cause bleeding, treatment can't be discussed. If the doctor is greedy for wealth, virtue can't be discussed. So he's basically saying there's a patient requirement and there's a doctor requirement that has to do with their willingness and their character. Next, writing the talisman. If you don't know, a talisman is like magical writing. Okay, so first make 2 copies of this thing that's called the Supreme Unity Spirit Talisman using cinnabar ink, that red mineral ink, which is also kind of has some magic to it. Burn one of the talismans to ashes, mix it with rice wine, and have the patient drink it. Paste the other on the wall in the patient's bedroom. Okay, so when you're writing the talisman, you're supposed to chant an incantation. And so, there's some stuff here. You have the handouts, or if someone's watching this later on video, you can pause the video to read some of the notes. Anyway, so this talisman is in Zhenzhou Dacheng. And it's actually a relatively unique one. Like, I have seen lots of Chinese talismans, and this doesn't look like most talismans that I've seen. Maybe it's from some school that I don't know of, but this is the talisman. And so you would, have grind your cinnabar ink, and you'd have your brush and your paper, and you'd, write it while you're chanting the incantation. So those are two versions from two different editions of Zhenzhou Dacheng. So here's the incantation. I'm going to tell you what the English says, but you would chant it in Chinese if you wanted it to have power. I believe that it will have a lot of power. If it has power at all, it'll have power in Chinese. It won't have power in English, especially not with my poor translation. I also want to say that these are really hard to translate because this is like Taoist mysticism, and it's referring to things that I just don't even necessarily understand or know. So I'm translating the best I can. And I am not a person who does talismans and incantations. Not because I don't believe, but it's just I never had a teacher, or, I never learned, and I'm not sure that I could do it. But anyway, so he says, first take a mouthful of air and then chant. Here's the incantation. The great Tiangang deity constantly revolves with the sun and the moon, ascends towards the golden palace gates, descends to extend over the Kunlun mountains. Tanlang Jumen, Luzun, Wenchu, Lianjian, Wuchu, Pojun, and Fubi. I'll tell you what all this stuff is in a minute. They make a great revolution around the edges of heaven. Fine particles of dust, right chi of the black and yellow, which means heaven and earth. These fine particles of dust hurry to enter my body. Wherever there are inauspicious spirits or malignant goblins, hurry and come under my command. Do not stir, do not act. Quickly, this is a lawful order. Okay, that last phrase is in almost all the incantations. Ji ji ru lu ling, I think, something like that. So you can see these are magical words. And one thing I find interesting in Zhenzhou Dacheng, there are like 5 passages where they're incantations, but nowhere does he say you need an empowerment. You need, somebody to give you this power. He just seems to assume that doctors can do this. Or know how to do this. But Zhenzhou Dacheng is like 500 pages in a modern English edition, and there are only 5 small sections that use incantations. So, that I think that shows that while incantations may be part of what a doctor can do according to Yang Zhizhou, but they're not the large part. It's mostly, physical medicine, but occasionally you need this. So, I really don't want to spend a lot of time trying to explain this, especially since I don't fully understand it. But there are notes here, which you can pause the video if you're watching, or you have the handouts, and this will explain some of the things that I could figure out. And so you're making this talisman while you're chanting that, which means you have to have memorized it and so forth. So any questions so far? Okay, let's keep going. So then the next requirement, he says, is that you need to settle your spirit. This means that the doctor and the patient both should correct their own spirit. If the spirit is not settled down, then don't perform acupuncture. Once the spirit is settled, you can do it. So you, the doctor, your mind has to be calm and stable and settled, but the patient can't be like ranting and, running around at that time. They have to, at that moment, be relatively settled. Proper countenance. This means that when you're holding the needle, don't look to either side. Your heart mind has no outside thoughts. It is as if your hand is holding a tiger with the power to capture a dragon. If you were in the episode we had on intent, then that as if your hand is holding a tiger, I think we saw that there. And, so he's saying that you have to have strong intent when you're needling the patient. Praying to the gods. Okay, this means that when you're about to insert the needle, close your eyes and focus your mind for a moment on your needling method. Like focus your intent. Your heart should contemplate Shenong, Huangdi, and true person Sun and true person Wei standing in front of you. So you're picturing, Shenong and Huangdi, these two mythological deities, and also two ancient doctors who were kind of deified. So Sun is Sun Simiao, and Wei, there's a note on the next page who he is. So you're picturing these two famous doctors in front of you, and you're also picturing Shenong and Huangdi in front of you when you're about to needle this patient. Silently say in your mind, after my acupuncture treatment, the disease will not relapse. That actually might be something, even if you don't do all the rest of it, that might be something to have in your mind as you're about to insert the needle in patients. I think that's kind of a cool thing. And then use another incantation for extracting diseases through the points. And so here, great is Qian Yuan, the mighty gathering of the gods in the heavens. The 10,000 diseases will be plucked out when my golden needle reaches the site. I serve Most High Lord Lao. Quickly, quickly, this is a lawful order. So Most High Lord Lao is deified Lao Tzu. And then they always end with quickly, quickly, this is a lawful order. Again, you can read some of these notes on your own. Pause the tape if you need to. And then incantation for acupuncture. You have to memorize a lot of incantations, don't you, to do this exorcism. So this means that when you're lowering your hand to insert the needle, exhale a mouthful of air onto the point. Silently focus your heart on burning fire passing through the needle while you use your power to slowly and gently insert it. And now we have another incantation. Qi spreads profound and true. The 10,000 diseases cannot invade. The channels and woe vessels continuously connect with each other. The dragon descends and the tiger ascends. The marvelous Tao of yin yang enters the spirit needle. When I needle, the heavens are going to open up. When I needle, the earth is going to crack open. When I needle, mountains will collapse. When I needle, the seas become empty. When the needle is inserted, disease is immediately quiet. When I needle, ghosts are completely beheaded and destroyed. I serve Most High Lord Lao. Quickly, quickly, this is the lawful order. Yeah, I like this. I don't know if I have the guts to do it in front of a patient. Actually, some of this could be done silently in your mind, but yeah. Well, if you're doing an exorcism, you may need to impress the patient, and their family, right? Like the power of this whether or not there's a ghost, but if there's a ghost, the power of this might expel it. And if there's not a ghost, then, you're going to have some good placebo effect with this, I think. Right? There's another incantation. I raise the golden whip while riding the ox facing backwards, which is how Lao Tzu left to go west. I drink in the yellow river and its water flows backwards. I suck in a mouthful and exhaust the water of 1,000 rivers. I move the human body and blood flows in the vessels. By authority of the 6 stars of the Southern Dipper, the 7 stars of the Northern Dipper, and Most High Lord Lao. Quickly, quickly, this is a lawful order. So he's like messing with the rivers, and that messes with the flow of blood in the vessels, hopefully in a good way. You can see there's some parallel stuff going on. Okay, then the text does talk about Sun Tzu Miao's 13 ghost points, but actually it just kind of lists them and says what to do. It doesn't really have that much interesting stuff. And he's quoting from Sun Tzu Miao. And so Sun Tzu Miao wrote about those 13 ghost points in Chen Jin Fang. And Sabine Wilms has already translated it accurately. If you want to know what Sun Tzu Miao said, you can go to this link, or if you just like search for Sabine Wilms ghost points, you'll find the translation on her blog. But I didn't want to take time to do that because it's already done, and it's actually not, it's just listing stuff. So you hear people today talk about all this esoteric stuff with the ghost points, and a lot of it, I don't know where it came from. It's not in any old Chinese book. That doesn't make it wrong, but Sun Tzu Miao didn't make it all, the way some modern people do. So you could read that. Anyway, so he lists the 13 ghost points. He gives some needling instructions. And then he says, at the crucial moment when you've inserted all those 13 points, then the doctor should ask the patient, which ghost, which demon did this to you? And the patient will tell you the cause. It's probably the ghost speaking through the patient. Record it with your brush, and when they finish talking, the mania will stop, and then you can take out the needles. This is a pretty common thing in exorcisms, is that you interrogate the ghost. And if you want to read a really interesting book, this Chinese magical medicine is very fascinating. It's an academic book, but it's still very, very fascinating. It's about incantations and talismans and other things like that in terms of healing in Chinese culture. So yeah, if that interests you, get that book. Okay, so there's a case from Zhenzhou Dacheng, but before that, like, wow, what do you have to say about this? You're stunned. I've exorcised all of you.
I wonder why you don't think it would be effective in English.
Well, I mean, like, are you going to do mantra in English?
I mean, don't do mantras, so no, I wouldn't, but maybe.
You could try, but then you're trusting my translation and my understanding, and you think there's power in my words. Yeah, you could do that. You could try. Let me know if you have success. I think some of it has to do with the sound, but then again, you get into this other sticky issue because, like, what dialect was that written in? What dialect were they speaking at that time? Even if they were speaking what one might call Mandarin, it's going to sound a lot different, just like people speaking English 500 years ago in England doesn't sound the way it sounds today. So you do have this issue. But I tend to think there's power in the characters and there's power in the Chinese words, and I don't tend to think there's power in my own words. Not that kind of power.
And just thinking like about, our last discussion around intention and like how much just the intention of what you're wanting to do with the incantation, like maybe there's just power just in that alone, and so the language doesn't matter as much, maybe.
I think you're right, but like at the same time, did you understand all those words? I didn't, even if I translated them. And so can you focus your intent when you're mumbling words that you don't even really understand? Maybe. I don't think I can.
Well, I would probably want to translate the like names of the stars into names of like, the names that we might know them by. If, assuming that those particular stars are ones that, I would know.
Yeah, that list of Chinese names were the stars of the Big Dipper, and they're very important in Chinese cosmology. And also, I don't know if you know anything about like flying star feng shui, but those are also the names of the 9 flying stars that are used in Chinese. And so they're used in various esoteric things. Yeah. I don't know if you try it using the English, let me know if it works.
Okay.
Maybe my words are more powerful than I give myself credit for. Maybe you could get a better translator who knows more about Taoism, like Alan Sarr. Yeah. Anyway, anyone else? Anything or any more from Eric? Okay, I'm
Well, I
moving
was
on.
just gonna say, I
Oh.
think could you also just hang this on your wall, like in your treatment room?
The incantation or the talisman?
Either one.
I don't know. Seems that it was used for a specific case as opposed to, it's not just a general protection talisman or something like that.
Okay.
I mean, really, somebody would have to know more about incantations and talismans than I do. I think actually Winnie's here and she knows more than I do. Are you here, Winnie?
Hi, everybody. I chant mantras in Taoist, Buddhist, Hindu traditions, and I always chanted in the original language when I practice yoga. Some of them have really long Sanskrit, and I have absolutely no clue what I'm chanting, like the Japji. But the benefit of chanting in the original language is you connect to everyone that has ever chanted the same phrase.
That's such a nice thought.
Yeah, so for example, if you think about chanting, let's say a Buddhist mantra, it connects you to all the monks all over the world, all the lifetimes that have chanted the same mantra, which is the power and the significance of chanting in the original language. So it's really worthwhile to speak it, even when I do Sanskrit mantras, I have no clue what I'm doing, but I feel it, the difference. So I really encourage people to chant it in the original language that is
It's like plugging into an electrical socket, you get the power.
And also I actually do exorcism on my patients. And by far the most powerful I've come across is called the Da Bei Zhou, which is the great compassion mantra, and it has 88 lines, and it's one per line for the 88 Buddhas. So you're literally saying the names of each Buddha, and I can type it in the chat box, and you can Google it, you can YouTube it. Every single time I have had to exercise something from my client, it's worked 100%, like 10 out of 10 times effective. So that is what I use in the clinic.
Do you also do the calligraphy? I think I remember that, right?
Yes, I also do calligraphy, which is like talisman, and that's also 10 out of 10 effective for exorcism.
So we'll have to have you as a guest speaker if you would be willing, but let's talk about that later. Thank you for sharing so much. Thank you for being here, Winnie.
Yeah, you're welcome.
I'll share something about the Da Bei Zhou. And there's also like music you can listen to. So many years ago, as part of my training, I trained in shamanism before I like came to this school. And one of my trainings involved listening to the Da Bei Zhou like 99 times. So I did listen to that, and it was chanted by a man 99 times. The day following that, I became very, very ill, and I was sick for 3 days straight. And in those 3 days, I just had very high fever. Nothing would bring it down, but I was also prepared, so I knew it was for a purpose. So I didn't panic or anything. So after 3 days, I recovered. It was fine. And I've been like very healthy since. But I just wanted to bring that up because in case you do decide to either chant it or listen to it or introduce it in a patient setting, it might be helpful context in case that does initiate some sort of physiological response to the frequency of those words, because it's the vibration of the word that is really carrying energy, I believe, is affecting the body. So if you decide to use it, I just wanted to share that example. If your patient does have some effect, it could happen. They could feel worse before they feel better.
Thank you for sharing.
I want to share one last thing about the Dabejo, how it actually literally saved my life. So I got COVID and my heart, my blood oxygen level went down to 88%. And I chanted the Dabejo one time and then it went up to 98%. Now, I use, Western medicine device to record my blood oxygen level. I was like, oh my God, did I go to the ER now? I'm like, wait, let me do the Dabejo first. And, like from 88 to 98. So I just say, if you want to see if it works for you, in case you ever in physical harm or danger, try it on yourself.
Thank you. Yeah, if you go to YouTube, it's recorded by a lot of different people. I think Tina Tin may have it. I really love Tina Tin. Let me put her name in chat. She has a lot of mantra recordings that are just really fabulous. Let's see. Yeah. Okay, so I'm going to continue. I think, we could do this again with people who have experience, because like I'm just a translator. I don't have any of this marvelous experience, and it would, this is like nice to start, but maybe we should have people who are actually doing this. So a future session, maybe, if these people are willing, I really appreciate it. So I'm going to keep going though. So in Zhenzhou Dacheng, the same book that we just had all those mantras and that one talisman, incantations in that one talisman there's a short case. In a certain year, the wife of a certain person suffered strange symptoms. I used Sun Tzu Miao's 13 needles for treating evils. I asked the patient, who did this to you? And she replied, on a certain day, I arrived at a certain place and a chicken specter, a chicken, supernatural being harmed me. Okay. So Yang Zhou, I ordered it to leave quickly. The patient then said, my disease is recovered. That strange evil has gone. And then her speech was normal again, and her own Jingshan had returned to her old self. So you can see the effectiveness of the 13 needles. So that's just a little case. There are two more longer sections. The first one is most long. Any questions so far? I could have made this much, much longer, but this is just like not supposed to be that long. There's so much you can find in the old books, but this is kind of the stuff I thought we should at least start with from my translator's point of view. Okay, so Zhang Jiabin, also known as Zhang Jingyue, wrote a book called Lei Jing, where he took all of Huangdi Neijing, he took Ling Shu, he took Su Wan, and he organized them by category so that all the stuff on the same topic is in the same chapter. And then he wrote commentary on all of it. And so here's the commentary on this thing that's called Juyo, which is hard to translate, but I decided based on what he says about it, I decided to translate it as invoking the origin. This is a phrase that's in Neijing. So, the first word, zhu, means incantation. It's the same as incantation. The second word, yo, means the source of the disease or where the disease is from. So we're invoking the origin of the disease. And this is based on a passage in Neijing that says, I didn't put that quote in here, but basically, it says that in ancient times, they could chant incantations and the disease would go away. But in modern times, incantations don't seem to work. What's up with that? And then the answer is because in ancient times, they could invoke the origin of the disease. They were more subtle than we are, both the patients and the practitioners were more subtle. So they could just invoke the disease, where it comes from, and then it would be cured. And so he's talking about that phrase, invoking the origin, means the method of talismans, incantations, interdictions, and prayers. But how can talismans and incantations be used to treat disease if it's not due to ghosts and spirits? Shouldn't those be only for ghosts and spirits? How could it treat other things? And so then there's a certain chapter of Lingshu that says, Huangdi, the Yellow Emperor, said, someone can suddenly become sick, but they weren't exposed to any evil qi, like, wind or cold or damp. And they didn't have anything going on in their mind bothering them. So how did they become sick if there's no weather qi, if there were no emotions? What's the reason? Could that be ghosts and spirits? That's the question. So Chibo, the advisor of Huangdi, the Yellow Emperor, said, and the reason I have certain things in italics is because, this is from Neijing, but now Zhang Jiebin is going to use those phrases again and again and explain those phrases. So anything in italics, we're going to come across that phrase repeatedly in the passage that follows. So Chibo said, it's the result of an evil that lingered but wasn't expressed. So kind of something that's latent, because the patient's mind loathes, hates something or yearns for something, then blood and qi become disordered internally. Both the evil that invaded and the right qi, the patient's right qi, both types of qi struggle against each other. So this is kind of like a subtle cause, because it was like lingering and hanging out and hiding, and it wasn't something that was obvious. So it's subtle. You can look for it, but fail to see it. You can listen for it, but you don't hear anything. So it seems like ghosts and spirits. And really, this does say, seems like, it doesn't say it is ghosts and spirits. It appears like ghosts and spirits. So then Huangdi asked again, well, then how can an invocation cure it? And Chibo says, the early shamans, they knew in advance where the disease would be engendered because they knew how the 100 diseases overcome people. So an invocation was enough. This sentence is hard to translate, and I'm not 100% confident in my translation, but going through what Zhang Jiebin says about it in his commentaries helps guide me in how I choose to translate it. So hopefully you can meditate on that for a while and see what you think. So now that's what Neijing said. And now here's Zhang Jiebin trying to explain it. He says, only these few words are needed to fully describe the Tao of this Juyo, this using invocations and so forth, to fully describe ghosts and spirits. But I want to add a few more details, he says. The above said, it seems like ghosts and spirits. The word seems like were written there. It doesn't say actually exists. It says seems like. He's really pointing out that it's not saying it's ghosts and spirits. It's just saying it appears like ghosts and spirits. It says they loathed something, hated something, or they yearned for something. This says ghosts and spirits are engendered in one's heart. Okay. It's about like your mind wanting things or hating things, pulling things towards you or pushing things away from you. It said they knew in advance where the disease would be engendered because they knew how the 100 diseases overcome people. So invocation was enough. That was like paraphrasing the whole sentence from Neijing. And he says this means that the source of the illness, what this is talking about the source of the illness, and it explains how to remove a ghost from the heart. How is this done? All 7 human emotions. If you're new this quarter, we'll talk about emotions in fundamentals class in another week or 2, but there's 7 emotions that we talk about in Chinese medicine. All 7 of them are engendered by liking something or hating something. When liking and loathing push your mind to one side because, ooh, I want this and I don't want that, so you're leaning to one side, then your mind becomes lopsided. When your mind is lopsided, then something's win and something's lose within your mind. So your state of mind is easily disordered, because you're just leaning too far in one direction. It's like you're biased, you're too subjective, you're not objective anymore. Once a state of mind has become lopsided, then there's a place for the evils to get in. If I'm all leaning this way, there's room on that side for the ghosts and the evils. And so these ghosts are engendered by the heart. So when you're constantly hating something, then you're going to see what you hate all around you. When you're constantly wishing for something, you're going to see that thing everywhere. It's like you hear somebody on Valentine's Day saying, oh, everybody else has a boyfriend and I don't have a boyfriend. And you just see all these happy, you're just seeing the thing that you want, even if it's not really there any more than usual. When you're constantly suspicious, then you see the thing you're suspicious of. When you're habitually dreading something, you see the thing you dread. So when your mind leans in one direction, that's actually the thing you're going to see more of. And it's not only this way with disease, dreams also are like this. This is what that passage means when it says the mind loathing something. And it also is what the passage means when it talks about yearnings. And so because of this, blood and qi become disordered internally, and then once everything's disordered in your qi and blood, in your heart and your shen, then you see these ghosts and spirits because you're seeing the thing all the time that you're afraid of or that you want. Yeah. Did I miss? No. Okay. So if your shen qi, if your spirit qi loses protection, then the result is going to be evils. For example, Suen 72, which is one of the lost chapters. And then sometime later in the history, somebody said, oh, look, I found the missing chapter. And so it's this chapter which talks about ghosts and so forth. So this chapter says that the spirit wanders and loses its protection in someone with deficiency. So evils and ghosts can harass from the outside. Just like weather chi, when I'm deficient, weather chi can invade. And also when I'm deficient, ghosts have an opening. There's an empty space for the ghosts. The next slide is still paraphrased from this lost chapter of Su Wen. We don't have to read the whole thing because it just repeats it for like the 5 elements. But basically, if a person has liver deficiency, then there's some cosmology here. There's certain, characteristics of years in something that's called Wu Yun Lu Qi. We don't have to care about that today. But if that adds to the deficiency, Jue Yin is liver. So if liver is deficient and if the liver qi of the year is deficient, then you're going to see white corpse ghosts. Okay, so it has this weird phrase, corpse ghosts. And what I assume that means is ghosts of dead people. Actually this word gui can mean things that were never human. It doesn't have to mean like a dead person's ghost. So I think this is emphasizing dead people's ghosts, but I could be wrong. Okay, but note that liver is wood and white is the color of metal, and metal chops wood. So it goes through and it says the same thing for all 5 elements. You know, black is the color of water, and that's going to be black ghosts when the heart is deficient. Heart is fire, water puts out fire. So it's the same 5-element relationship for all of these. And I'm just not going to read it because you can read it. Okay. And it's not just these corpse ghosts, whatever they are, but generally all types of harassment by evils are because the spirit loses protection in its position. So this means right chi deficiency leaves a space where evils can come in and overcome it. And so these 5 types of ghosts, according to the 5 elements, are engendered. And this is what it means by the result of an evil. Also, this is what it means by knowing how the 100 diseases overcome people. Like you've got the schematic for this problem, you know, oh yeah, it's according to the 5 elements. So he's quoting from some other ancient book. It's not a medical text. And it says, when the heart is thinking about lucky and unlucky, certain types of ghosts are attracted by it. If the heart is, you know, kind of obsessed with sex, then lustful ghosts are attracted by it. So that's why, you know, the woman in the temple on the veranda, she got a lustful ghost, I guess. When the heart is full of gloom and worry, ghosts of the depths are attracted by it. When there's release and leisure, like you just want to have a good time and do whatever you want, then you get unrestrained ghosts and so forth. The last one's interesting. When you're all, you know, focused on medicinal elixirs, then ghosts of material substances are attracted by it. I don't really, you know, some of this is like, what does it actually mean? I don't know, but it's interesting. So this is stuff we have to ponder. This is really ancient stuff. Stuff is more than 2,000 years. This page is more than 2,000 years old. But Zhang Jibin is only like, he published around 1620. So, you know, that's 400 years old. Okay. So Zhang Jibin goes on, he's done quoting from that book. He says, this means that when the heart has something, a thought, concentrating in it, you know, when a thought is concentrating in the heart, in the mind, then that implants something in the spirit. And whatever that thought implants in your mind, if it's not upright, if it's not proper, that's going to make the ghosts. This is the meaning of knowing where the disease comes from. So we should keep our mind on proper things if we don't want these kinds of ghosts bothering us. Once the root is understood, then you can figure out how to treat it. So once you've observed what the patient hates or what the patient is longing for, then no invocation will fail to be effective. In other words, all invocations will be effective once you know what's going on in the patient's mind, he says. Well, that might be an exaggeration, but anyway. So now he goes on with some cases. Somebody named Wang treated a woman who suspected her husband had an outside love interest. This is really she's not a nice woman though. Okay, so this caused her to get sick and lose her mind with mania and suspicion. So, you know, I mean, it's like understandable that a wife will be concerned, you know, a spouse will be concerned when they think the spouse is cheating on them. And it can make some people really act kind of crazy. So even though she took medicine, she didn't get better because this was something of her emotions in her mind. In the end, the medicine didn't remove the problem. So Wang, then the doctor, made somebody falsely claim that, oh, poor woman, she died suddenly, she's gone, and made sure that the patient overheard it. So now the patient thinks that her husband's lover is dead. And so she was very happy and then she recovered. And so even though this isn't really using shamanism, what they did is remove what she loathed. Remember, he's talking about it's either what you're attracted to or what you want to get away from. So, she hated this, so they got rid of what she hated, and now she can get better. There's another case that we talked about in the session when we talked about emotions. So I'm not going to read this whole thing. You can refer to the other tape, but basically a woman's mother died and she was missed her mother so much she just couldn't get over it. So the husband had her hire a shaman, and the shaman pretended to channel the mother but had the mother say kind of hateful things. And so now she got mad at her mother even though her mother's dead, and so now she's not sick by longing for her mother. And so he says this is removing the thing that you're longing for, that you're yearning for, that you're wishing for so much. And so they're talking about kind of using psychological methods to remove the thing that you're obsessed with from your mind. And then here, this has that quote, in Suan chapter 5, it talks about that anger bothers the liver, but sorrow overcomes anger. And so that's the 5 element thing. Anger is wood. Wood controls what? Anger bothers the liver. And okay, sorry, let me start again. Anger bothers the liver, which is wood, and then sorrow, which is metal. It has the control relationship. So if you can induce sorrow in somebody who's angry, their anger will be reduced. And so we also talked about that in the earlier session. The video is available. And he says, this is the method of finding the cause. You got to find the emotion that bothered your mind and then find the other emotion that controls it. So yeah, we talked about that. And then there's some stuff that's partly less interesting and partly hard to translate. So I'm jumping over a little bit of the text. Zhang Jaebin says, I once treated a young married woman who had a hot evil taking advantage of her stomach. So that's like a Yang-Ming heat evil. In Chinese medicine, Yang-Ming heat can sometimes make mania. Okay, so it was rooted in an attached ghost or spirit. There was a ghost or a spirit that was attached, and that's what made her so hot. She beat things and cursed things and had fright mania. The heat just like agitated her so much. The whole family was afraid of her. So they wanted to call a shaman to treat her. But they consulted me, Zhang Jaebin. And I said, no need, I can take care of it all. And so first, I had someone announce me to the patient in a loud voice, as if he was really important, like you're announcing an important guest. And I took care of my appearance, and then I entered suddenly and dramatically. The patient was wearing dirty clothes. She was disrespectful. She was manic, We stared at each other face to face, but I glared at her fiercely to subdue her. And after facing each other for a long time, she then suddenly started blushing, and she became more, instead of being manic and angry, she started becoming more feminine. And her spirit became timid. And then she tried to hide. But I had somebody tie her up, and she got fearful. She wasn't trying to leave. And then I made her take a dose of Baihu Tang, which is the formula you would take for Yang-Ming heat, or one of the formulas you could take. And the evil went away. So I used my impressive and dignified manner to overcome her disrespect, and I used cool and cold herbs to overcome the fire. Okay. Oh, and this, I think this is the last of Zhang's cases, and this is really kind of a fun case. I treated a Confucian scholar named Sheng, who had metal and water organ deficiency. So that means lungs are metal organ and water organ is kidneys. So he has lung and kidney deficiency after Shanghan, after cold damage, after cold invasion. At noon one day, he suddenly sighed and said to me, all my life, I've made it my business as a Confucian to never cheat anyone, never harm anyone. Why is there an old white bearded person wearing plain white clothes and holding a fan? And by the way, the words that say plain white clothes could also mean mourning clothes, the clothes you put on when somebody died. Okay. He watches me and he hasn't left in 3 days. I think he must have some long-standing grievance against me. Why? So Zhang Jiebin smiled and said, isn't the fan he holds made of white paper? And Sheng was surprised and impressed and said, oh, you see him, don't you? But Zhang said, no, I don't. So note he has a white beard, he has white clothes, he's holding a fan, and Zhang Jiebin confirms it's a white fan, but it's like a ghost. Zhang doesn't see him. So Zhang says, according to, this lost chapter of Suen that we saw before, when somebody's Shen loses its protection because of deficiency, the 5 ghosts harass it from the outside. Remember that 5 element, what kind of corpse ghost you see? I further explained, because you have lung qi deficiency, your eyes see white. It uses the word flowers, but it means like stuff that's not there. And so they see white ghosts. And I do want to point out that in the previous passage, it says that if it's liver, you're going to see white ghosts, but now he's using the same element. Lungs are metal, white is metal. So he's actually contradicting what he said before. If kidney water is insufficient, the eyes are going to see black stuff. Because black is the color of kidneys and water. You should probably, I bet you're seeing a black ghost. And this is all due to deficiency of your right qi. So your Shen and your Hun can't properly attach to the body. And so now they're, they outwardly see the root color of the organ that has the problem. Okay, so black is the root color of the kidneys, white is the root color of the lungs. Besides, what grievance could anyone possibly have towards you? You're a good guy. Nobody has a grievance against you. So Sheng was happy and said, oh, what a marvelous theory. Yeah, there is a black ghost that's beside my bed. And even though I'm not really afraid of him, I'm really like grossed out by it. I have an aversion to it. So I don't even want to talk about that black ghost. Now you've cleared up all my misunderstandings. And then Zhang gave him herbs and he took them for the 2 organs. And he says, this is knowing where his disease came from. And these are the profound words that released it. In these examples, all the ghosts were engendered from the heart. It was not really done by actual ghosts and spirits. These are things that came out of the patient's heart. That's why the text says it seems like ghosts and spirits, not it is ghosts and spirits. So when it's like this, the ghosts and spirits are in the heart mind. And if you try to use herbs and stones, which is kind of for reasons we don't have to go into, meaning like acupuncture, moxa, bleeding therapy. So anyway, since it's in your mind, it's hard to use herbs and acupuncture successfully because they treat the body, not so much the mind. These are not cases where invoking the origin will fail. In other words, these will be successful cases for this kind of treatment. So there's just one more section. We're at an hour and a half now. I'm happy to do the last section. But do you have any questions first? Oops, sorry. No questions, comments. There's something in chat I'm trying to see. It's there's, you know, from Winnie, a long chat, and I want to read it, but you know, some people probably need to go, so I'm gonna finish this stuff first. Yeah, so I know some of you need to go at this time, but the video will be available, and if you have anything you want to say before you go, please say it. I'm happy to hear from you. Yeah, anything? Okay, so I'm gonna finish. There's this person named Shuling Tai. He's kind of an interesting guy. This is short. There's only like 5-6 more slides. Okay, so he's a Qing dynasty doctor. Qing? Yes, Qing. He says, people who receive evils, there must be some place where the evils are received. Once the evils have been called over, they respond and they come and they get there. And so when your Jing Shen is completely secure, external evils don't dare to invade. They'll only bully you and they'll only gather when your resistance has been depleted. Again, we see repeatedly that the ghosts are only going to harass deficient people, not people who are full and strong. Generally, in disease with spirits and ghosts bothering you, the foolish and ignorant think it's actual spirits and ghosts that are bothering the person. People who are, you know, use logic and reason think this can't possibly be ghosts, but both are incorrect, because actually he thinks sometimes it's ghosts and sometimes it's not. So if your position is, yes, it's always ghosts, you're wrong. Sometimes it's not. And if your position is it's never ghosts, that's also foolish, he's saying. So he says, ghosts and spirits are like wind, cold, summer heat, and damp. They're like weather chi. When wei qi is deficient, then cold can invade. When yin qi is deficient, heat will invade. But when your shen qi, when your spirit qi is deficient, that's when ghosts can invade. This must be because the human spirit is yang. And so when yang gets weaker, then yin can overwhelm it, and ghosts are considered very yin. So you know, if you have plenty of spirit's yang. If you have plenty of qi is yang. And so the ghosts aren't likely to invade at that point. So among points on the channels, there are points like ghost bed and ghost house. So actually there's a note down here, like, what is he talking about? He's an herbalist. Like, what does he know about acupuncture? Anyway, Sun Tzu-miao's ghost points all have names like ghost bed, which is one of the ones that he mentions. And that is an alternate name for stomach 6, which is one of Sun Tzu-miao's ghost points. But the second one, ghost house, there's not one of Sun Tzu-miao's ghost points is named that. And in addition, when I search in Chinese, it doesn't come up with anything. So it's like he just made up a random name and said it's a name of a point, or it's a typo. Anyway, but there are at least Sun Tzu-miao's ghost points that have these names. So he says among points, yeah, some points have these ghost names. All points like this rely on being filled up and stoppered with shen qi. What he's saying is that if you've got abundant shen and abundant qi in your body, a point, actually the word that means an acupuncture point, it literally means a hole. These holes are opening into the body. And if the hole is filled up with shen, and if the hole is filled up with qi, there's no opening for the ghost to get in. And so if shen qi is depleted, ghosts and spirits can encroach on these points. Like the points are called ghost points because they treat ghosts, but they're also places where the ghosts can enter. It's just like wind and cold's ability to damage a person. He's really comparing ghosts being able to invade to wind and cold being able to invade, but instead of it being Wei Qi deficiency, it's, deficiency of spirit. To treat someone with cold, we strengthen their yang. To treat someone with heat, we nourish their yin. To treat someone with ghosts, we fill up their shen, and that's all you got to do. He says, though, besides this, there are diseases from ghosts that you've offended. They're not just random ghosts taking advantage of your deficiency, but sometimes you personally have offended a ghost or spirit. If that's the case, then praying to the gods will cure them. If it's that you're deficient, then filling up the body will cure it. But if it's because you offended a ghost, then you have to pray to the gods. But there are also ghosts of the unjustly condemned, like people who died for unjust reasons. And it could be that the person's own bad behavior caused the ghost to hate them deeply. Or it could be that their ancestors harmed someone and that ghost is bothering not only the ancestor that did it, but the descendants. Or it could be that maybe you accidentally harmed someone. You were driving drunk and you didn't mean to harm the person, but you killed them. Then that ghost could be mad at you. All these situations can be verified. He said, I've seen many of these with my own eyes, but this kind of ghost that's from the unjustly condemned can't be removed by using herbs, can't be removed by using acupuncture-like stuff, can't be removed by prayer from the gods, because you've got some bad karma going for you. I'm actually really surprised because Shuling Tai is always a skeptic about so many things, but yet here he is saying, yeah, these ghosts, they're real. So again, I had this quote from the one on intent. Magic is just science we don't yet understand. And I want to thank Eric so much for putting all, the event together. And I want to thank Empress College and I want to thank you guys. But now I'm ready for questions or comments. There is some stuff in chat. Let's see. So when he says, I agree, it's often spirit chi deficiency or the 7 emotions or phlegm misting the heart. I agree that all we have to do is fill up their shen. In situations where the patient has negative karma, then I teach the mantra. And yes, you as a practitioner have to not take on somebody else's karma. I totally agree. So yeah, if you have to go, feel free to leave. And if you want to check for questions, you can check on the video. But anyway, what else?
I just wanted to say that it's not that we want to be like, ooh, look, it's so cool that I can exercise and pick negative entities out of someone. Is that, if we don't know what we're doing, we can catch this from our clients. So it's really the first reason to learn this is to protect ourselves in the clinic.
For sure.
And so my first year as an acupuncturist, I was chi deficient and I would get negative entities on me all the time until eventually I learned to protect myself. So I would say everyone should learn mantras, just if nothing else, even if you don't use it on your clients, is use it to protect yourself.
And I also would like to say that I studied a long time with a feng shui and astrology shifu, and he so emphasized that if somebody's pregnant or could be pregnant, do not go anywhere near this stuff. Yeah. So not only protect yourself, but protect the baby if that's part of it.
When you say do not go anywhere near this stuff, do not go anywhere near mantras?
No, like anything that could be ghost-ish.
Oh, okay.
Like doing feng shui for a haunted house or working with somebody that you think could be possessed. Yeah. Mantra, fine. As long as it's like not some kind of evil, weird mantra. Yeah.
One of my teachers talked about how, like, tradition, traditionally Chinese people wouldn't go hiking because they, like, you would encounter ghosts and spirits out in the wilderness, and so you're more likely to become possessed or to pick something up out in, on a hike than you are in the city.
There are a lot of stories about that in, those tales of the strange. There's a lot of times when somebody's, out harvesting herbs or hunting or whatever, and then there's these strange occurrences and fox spirits and stuff like that. But I think if it's a, normal trail that's well used and so forth, it's probably not a problem. If it's daytime and bright out, but don't get stuck in the forest at night. Ooh.
Yeah, I'm just imagining people, who are like at festivals and stuff, like out in the forest, like taking huge amounts of, LSD and things like that. Just like inviting all the ghosts and stuff into their bodies.
Yeah. Well, and that invitation is, why a lot of the stories are about lustful people, because that's kind of like an invitation. If you're feeling sexy, you want a partner, and then it's like the ghost says, okay, I'm here. Yeah.
I know a few people who have had experiences with like sort of dream paralysis or like succubus style. And it was when I was younger and before I was in school or anything, but some of it feels so connected to what we've been talking about, where, and I think a lot of it was from a time where there was like chi deficiency in the person or some sort of, like we're young, we're partying, we're doing all these things. And then like you're saying, like one morning you wake up and you can't move and there's something like interacting with you in that space. And I think it's cool to start to think about it through this lens.
Yeah, there's a thing called Mengyan, which is like ghost oppressive dreams, and it's pretty much the equivalent of sleep paralysis. And the point to do for that is actually moxa on spleen 1 and treat whatever else the patient has. Of course, if like you're not going to know when they're having sleep paralysis, this would be like, oh, I keep having this thing happen to me. Then you would use that as the treatment. And actually, spleen 1 is one of Sun Tzu Miao's ghost points. It has some power. There are also some other points. There's like ghost crying points that you do moxa on. A lot of the points for against ghosts are you do moxa on those points. Ghosts are yin, so if you do yang, that helps. But there's certain points that kind of, they may do other regular things in Chinese medicine, but there's certain points that are used for ghosts. And at first I was, including some of that stuff in the slideshow, but I just thought, some of the theory stuff and the cases we needed first. So I don't know, I could sometime maybe expand this with more treatment options or something. Yeah. So anyone else? So I guess one of the problems with going long is that now when we talk about acupuncturists without borders, a lot of people are gone.
Oh, that's okay. But people will see it on the recording.
Mm.
I don't really have like a whole lot to say. They like, do, I honestly don't know that much about them, but they do work with people or communities that have, experienced natural disasters, and they do trainings for acupuncturists to work with people who've experienced trauma. So, we're asking people who've attended to or watched the video to make a donation of $5 or $10 to Acupuncturists Without Borders. And I'll drop the link in the chat. And I just want to say thank you so much to Dr. Wilcox for the huge amount of time that she's put into this, not just this presentation, but like all the many years of studying and hard work to like get to the point where she's able to present this really special and awesome information to us. So thank you so much.
It's fun, and I'm glad to have somebody who actually wants to hear some of it. Yeah.
We are really happy and honored to be here. And
Thank you, Eric. And it wouldn't happen without you doing the work to set it up and coordinate it. And so you're an important part of this too. And of course, the people who come and participate or just listen. So thanks, everyone.
yeah, thank you all so much for coming and for participating, and your questions. Everything has been great and really valuable, added so much. And yeah, I'm having a lot of fun. So thank you all so much.
I'm going to stop recording, but you don't have to go if there's anything